Rise America on this Tuesday, April 2nd. I'm Debbie Turner-Bell. Joining me today is my partner in news, Christina Brown.
Good morning, Debbie.
Good morning. And our business editor, Andrew Schmertz.
Good morning, ladies.
Hello to you as well. Coming up today on the show, are we over-medicating our children to combat attention deficit hyperactivity disorder? A new report is raising concerns.
Broadcasting live from the heart of New York City to the U.S. and across the globe, this is Arise America.
The number of U.S. school children diagnosed with ADHD has dramatically increased in the past decade, up 53% according to new data from the Centers for Disease Control and Prevention. 15% of school-age boys have been diagnosed with ADHD. The rate for girls was 7%. Among those of high school age, 14 to 17, 19% for boys have been diagnosed, 10% for girls. About 1 in 10 high school boys currently take ADHD medication. Joining us to talk about all of these statistics and their ramifications is teaching consultant and former New York City public school teacher Natalia Jackson, as well as clinical psychologist Dr. Joel Volpe, who is a psychologist at high school here in the New York City area. I want to welcome both of you and thank you both for coming on to talk about this very important issue. Dr. Volpe, Joe, I want to start with you. Why are we seeing this increase in diagnosis for ADHD?
I think one of the key things is that people are becoming more aware of the condition. And we've seen this similarly with spectrum disorders, autism. When people become more aware, they may be more prone to look for symptoms. Sometimes these are very valid concerns, sometimes they may not be. And as a result, when they go to a professional, they're going to be looking for some kind of information from that professional to either confirm or deny that the condition exists.
And that is the concern, that if there are kids that are being misdiagnosed or improperly diagnosed as having ADHD and then treated with the behavior-modifying drugs like Adderall, Ritalin, so treated but not really have the disease, then what is the danger there?
Well, if someone without ADHD takes a medicine, one of the more commonly used medicines are stimulant medications like Ritalin or Adderall, it can actually have very bad side effects. These are performance-enhancing drugs when people without ADHD take them. It's a big difference when you have people who truly have ADHD who take these medicines. They actually show many gains. Many of them actually are calmer and they're more focused and they're more productive. That's for people who genuinely have the condition.
And that's the big if, right? With this data, what concerns you about the jump in these numbers?
What concerns me is that, it is a surprise. I've been a specialist for about 19 years assessing and treating ADHD in children through adults. And I can tell you that's probably twice what it was, 2 or 3 times what it was when I began. The concern is that many of those people are probably misdiagnosed, maybe don't have ADHD but have something else, and perhaps were never really properly evaluated. Yes. And that's a big concern, because if they're not properly evaluated, then they'll never be properly diagnosed. And if they're improperly diagnosed, the treatment will be different. And some of those treatments can be potentially dangerous.
Of course, you and I had a conversation about this yesterday. You talked about the fact that ADHD is not a biological disease. It's not a physiological disease. And so, therefore, the approach to diagnosing it should be different than just taking a blood test or a urine test, because they really can't be diagnosed that way.
Well, just to clarify it, we do know there's a lot of research talking about the neuroanatomy of ADHD and about chemicals that are associated with it.
Sure.
However, like many conditions in psychiatry and psychology, there really are no biological markers. So with regard to that, as a clinical syndrome, you do need to take the time properly to evaluate, because there is no urine test, blood test, MRI, really that conclusively diagnoses.
And what about the long-term research, the long-term effects on these children? What does the data suggest 30, 40 years after taking it?
It's a great question, but when we talk about the medications that have been used, they've been on the table for many years, over 50. Ritalin is one of the oldest medicines that has been used and researched for these conditions.
For this age group.
But long-term effects are still a big question mark, because you're talking 15, 20-year research studies, longitudinal studies. And basically we have a lot of anecdotal information. I could tell you I've had people that I've worked with many years who really haven't had adverse effects. My bigger concern is had they not had the proper treatment, in this case maybe medicine was a part of their treatment, that could have actually been very bad for them. The side effects notwithstanding, the benefits of being on the medicines for some of these people were tremendous. They got work done.
Yeah, you know, I think the important thing for parents who might be out there is to make sure that the evaluation is correct. I think what the doctor shared with us is that evaluation process, if it's not carefully done, is what leads to misdiagnosis.
I want to bring Natalia into this conversation because you were in the classroom for 10 years and you still teach, you still work with students.
Yeah.
Tell us the trend that you saw in the classroom from 10, 15 years ago to today, what you see with kids.
Right. I think that what is being asked of the children has changed a lot over time. They're increasingly being asked to sit for longer periods of time. There's not a lot of play. There's a lot of performance-based things for a 5-year-old, for example, to write sentences and to learn in a way that is almost not developmentally appropriate. It's almost like we've thrown developmentally appropriate practices out of the window.
You know, and you bring up a very good point. I wonder how much finances play a role in this because, of course, pharmaceutical companies have made a whole lot of money off of these drugs, and they now, and I'm not indicting the pharmacy industry here, but you know they direct market to the public. Those are commercials that are on television. So what role, Joe, does the marketing of these drugs play in the parents' demand for the addressing their child's lack of performance in school, not being able to keep up or sit down, whatever the case might be?
Yeah, I think exposure to these commercials certainly makes parents, especially those concerned about their child's performance, wonder. You know, at the very least, speculate. Is this a way of helping my child do better, get the better score or whatnot? The reality is this, that parent then, maybe seeing that commercial, will end up in a professional's office. It is now incumbent upon that professional to take the proper time to evaluate. The problem is that there's really no clear consistency between professionals.
But what about attempting to improve their child's academic well-being or well-being through private tutorial, behavior modification?
Right. I'd say they're essential.
Yeah.
We were having a discussion earlier. We were talking about the importance of skill building, especially with the executive functions, which really are at the core of attention deficit, which is things like time management, planning, organization.
Absolutely, absolutely. I want to get your anecdotal experience with seeing kids. What does a child that perhaps has been misdiagnosed with ADHD and is improperly medicated, either shouldn't be medicated at all or over-medicated, what does that child present like in the classroom?
They sleep all day. I have never had a child in my classroom, not one time, at least one child in the classroom is either sleeping, or if they're not asleep, if they didn't take their meds that day, then they're kind of, you know, they might be a little troublesome in terms of their behavior because they never really get the opportunity to manage whatever it is that they have. Whatever it is that is getting in the way of their being able to perform is never really being addressed because either they're over-medicated and asleep, or they're not getting the behavior modification for them to get what they need. And when they're awake, they're disruptive. You know,
and we're almost out of time, but Joe, just give me very, very concisely, if a parent is concerned about their child, whether or not they have a learning disability, whether it's ADHD, what should that parent be sure to do to advocate and address the issue for their child?
A consultation with a professional who has a history of working with ADHD is essential because it really begins with, usually these evaluations should be 3 to 5 meetings. They're way more than 15 minutes. So interviewing, developmental history is very important. Psychological testing to rule out other conditions, very important. Learning disabilities occur in up to 50% of kids with ADHD. Very important to look at all components and medical evaluation to rule out auditory or visual problems or metabolic conditions.
Yes.
Very important.
All right, there you go. Dr. Joe Volpe, Natalia Jackson, thank you so much. We appreciate your time.